A family of up to 5 members can access health services worth 1 lakh rupees annually by paying a premium of 3,500 rupees. For larger families, an additional 700 rupees per person grants access to an extra 20,000 rupees in coverage with a maximum coverage of 2 lakh rupees for a family of 10. However, accessing these promised benefits is proving to be a major hurdle. Health insurance is designed to cover a wide range of medical needs. Insured individuals are entitled to 1,135 types of medications and services from outpatient care to surgery. Hospitals often lack the capacity to provide adequate treatment, and essential medicines are frequently unavailable. Patients with insurance are being turned away or told to purchase the medications elsewhere. This has led to widespread dissatisfaction, with many choosing not to renew the insurance policies. Another critical issue is the lack of enforcement of existing laws. The Health Insurance Act of 2074 mandates that all citizens must enroll in the health insurance program. This mandate also extends to civil servants and families of migrant workers. However, the government has been hesitant to enforce these legal provisions.
हामीले भन्दाखेरि 753 मा नै हामी सेवा दिएका छौं भनेर भनेका छौं, तर 52% चाहिँ नि स्थानीय तहमा प्रथम सेवा बिन्दु वहाँ बीमित व्यक्ति गएर सेवा लिने ठाउँ नै छैन, अर्को पालिकामा अर्को ठाउँमा गएर सेवा लिनुपर्ने स्थिति छ। भने अनुसारको उपचार पाइएन भन्ने छ, उपचार लिने क्रममा लामो लाइन बस्नु पर्यो, अप्ठ्याराहरू भयो भन्ने छ। बीमित व्यक्तिलाई गर्ने व्यवहार सेवा प्रदायकले गर्ने व्यवहारमा अलिकति भिन्नता भयो भन्ने खालका गुनासाहरू पनि छन्। ती सबै कुरा चाहिँ स्वास्थ्य तथा जनसङ्ख्या मन्त्रालय, सेवा प्रदायक, स्थानीय तहहरू, प्रदेश सरकार, निजी क्षेत्र र स्वास्थ्य बीमा बोर्ड सबै मिलेर चाहिँ त्यो सेवालाई प्रभावकारी कसरी बनाउने, किन भन्दा यो कलेक्टिभ चाहिँ रेस्पोन्सिबिलिटीको कुरा हो, सामूहिक उत्तरदायित्वको विषय चाहिँ हो।
Then there's the problem of misuse. While the core principle of health insurance is to support those in need, there are instances of individuals seeking benefits even when they don't require them. Health facilities are also being accused of providing unnecessary services for financial gain. The government introduced co-payments in 2018 to curb misuse, a 10% co-pay in government hospitals with over 15 beds and 20% in private and community hospitals. However, this measure has not led to significant improvements. Perhaps the most pressing challenge is the issue of financial sustainability. The government allocates approximately 7.5 billion rupees annually to the health insurance program. Premiums collected amount to between 3 and 3.5 billion rupees. However, expenditures exceed 13 billion rupees, creating a substantial deficit. As a result, the government has been unable to reimburse hospitals since June, affecting 484 hospitals currently participating in the program. Hospitals are facing operational difficulties and struggling to provide services to patients.
1.5 वर्षसम्म पैसा सरकारले नदिएपछि के हुने भयो? अस्पतालले औषधि नपाउने भयो। औषधि अस्पतालले नपाइसकेपछि के हुने भयो? जनताले औषधि नपाउने भयो। हैन? समस्या यहाँनेरि आयो के? यो त औषधिको पार्ट हो। अनि अस्पतालमा कर्मचारी हुन्छ हुँदैन? हजुर। अनि बिमा चलाइसकेपछि कर्मचारीले तलब नखाइकन तपाईको काम गर्छै गर्दैन। बिना तलब कर्मचारीले काम गर्छ? गर्दैन। अनि अस्पतालहरुले बैंकबाट लोन लिएका हुन्छन् हुँदैन? अनि हरेक 3 महिनामा राज्यको पैसा अस्पतालहरुले राज्यको पैसा बुझाउनु पर्छ पर्दैन? के रे बैंकको पैसा सामरा ब्याज त बुझाउनु पर्यो। भनेपछि त अस्पतालहरु त बैंकरप्टको स्थितिमा जाने भयो।
In response to these systemic problems, the government formed a task force led by Dr. Shambhu Acharya to recommend reforms. The task force concluded that the current system is unsustainable and called for a complete restructuring of the health insurance program. Recommendations include integrating health treatment support programs under the Health Insurance Board, expanding insurance coverage to 5 lakh rupees, implementing the program at all 3 levels of government, and prioritizing enrollment for elected officials, government employees, and those in organized sectors. However, the timeline for the implementation of these recommendations remains unclear. Citizens are facing a double bind. They enroll in insurance but struggle to access necessary medicines and healthcare facilities. Laws designed to increase enrollment and funding remain unenforced, and efforts to improve the system are hampered by a lack of coordination between different levels of government.
उच्च स्तरीय समितिले दिएको बीमाको प्रतिवेदन कार्यान्वयनको चरणमा गइसकेको छ। अब जुन तत्कालै गर्न सकिने थियो त्यो तत्कालै चाहिँ केही 1-2टा काम चाहिँ भइसकेका पनि छन्। केही 6 महिनामा, केही 1 वर्षमा र केही 5 वर्षसम्ममा गर्ने गरी चाहिँ त्यसलाई विभाजन गरिएको छ। त्यही अनुसार चाहिँ सम्माननीयज्यूसँग, नेपाल सरकारसँग, क्याबिनेटसँग, विपद प्राधिकरणसँग सबैसँग चाहिँ अहिले समन्वय र सहकार्यको चाहिँ काम चाहिँ भइरहेको छ।
It is crucial to remember that health services are a fundamental right of every citizen. Basic health care should be provided free of charge. Yet, even with insurance, access to essential services remains a challenge. The fact that only 20% of citizens have enrolled in health insurance after 9 years, and that even they face difficulties in accessing care, is a matter of serious concern for the government.